were, in some cases, the very scientists who were complicit in the origins of the gain-of-function experiments that may well have created COVID. In essence, the intelligence community pays researchers to review work and write papers. NIH funds their grants. The CIA then consults them and gives them access to classified information. The national academies publish their work. Policymakers then cite the result as a consensus. But it's a circle. At the center of the government side of this circle was Dr. Anthony Fauci. For years, Dr. Fauci was not merely a public health official speaking from the NIH. He had a long-standing relationship with the national security and intelligence apparatus on biological threats, dangerous pathogens, classified life sciences researches, pandemic preparedness, and COVID origins. Again and again, documents show him being brought into national security discussions far beyond ordinary public health messaging. During COVID, intelligence officials arranged for Dr. Fauci to review highly classified intelligence assessments that could not even be sent outside the White House complex. But how can Anthony Fauci objectively comment on a discussion of COVID origins when he approved the very funding that may have caused the pandemic virus? From the outset of the pandemic, Dr. Fauci shaped the conclusions. Dozens of times, he referred to the idea that the pandemic originating in the lab was a conspiracy, that it was a conspiracy theory. Dr. Fauci convened the now infamous February 1st, 2020 call. Some scientists on that call privately raised serious concerns about a laboratory origin. Yet, ironically, those same scientists later co-authored the proximal origin paper, which publicly dismissed the lab leak hypothesis. One author received a $9 million grant from Dr. Fauci's own agency after he changed his opinion from lab leak on the private phone call to natural origin in public. At the same time, Dr. Fauci coordinated with the national academies on coronavirus origins and public-facing messaging. These were not independent experts reaching a consensus. They were part of the same machine, designed to reach the same conclusion. The question is not whether the government may consult experts. The question is whether those experts were independent, whether conflicts were disclosed, whether dissenting views were preserved, whether the lab leak possibility was fairly evaluated, and whether Congress and the American people received the truth or a curated result. When Congress asked these questions, government officials lied to our face. They classified the documents. They suppressed the information. They changed the definitions. They invoked sources and methods. They told Congress only what they wanted Congress to know. In 2023, John Ratcliffe, the former director of national intelligence, testified before Congress with a stark warning. He said a lab leak was the only explanation credibly supported by intelligence, science, and common sense. He warned that partisan politics and analyst disagreement with Trump administration policy, Trump derangement syndrome, had created illegitimate roadblocks to the truth. I agree. He said the COVID-19 Origin Act, which Congress passed unanimously, should finally make intelligence on COVID's origins public. I couldn't agree more. Despite a unanimously passed law, though, requiring the declassification of all information related to COVID origins, the deep state still resists this congressional mandate. Our witness today will explain what happened inside the CIA. According to his testimony, CIA scientific analysts concluded multiple times between 2021 and 2023 that a lab leak was the most likely origin of COVID-19. Yet those conclusions never shaped the official narrative, never made the intelligence report. Congress was never told. It was not until after the 2024 election that the outgoing Biden administration directed the CIA to issue an assessment, not because of new intelligence, but so officials could walk out of the door claiming there was nothing left to find. That is not analysis. That is a cleanup operation.